Hey, what's up guys? Hope you have a smile on your face. This is the Dental Review Guy. Today to talk to you about something extremely important, which is dental magnification, also known as loupes. There are many styles of loupes available. The first one we're going to talk about, this one is really inexpensive. This is a headband style kind of loupe, and you just mount this on your head and you get the magnification in place. The advantage is if you're working on a patient and you don't need the magnification, you can just flip this up and then your vision is clear again. This style also comes with a lot of little attachments over here which have different levels of magnification. But honestly, I don't think these loupes are that great, and this light also is kind of cheap and doesn't really give you the illumination you need when you're working on your procedures. So this one I'd say I don't recommend, but maybe for like very non-critical lab work perhaps you could use this. These are really inexpensive, but don't expect them to last too long. The next style is the TTL style, which means through the lens. So the loupes themselves, or the magnification, goes through the lens. And that's why it's called that. These were the first real loupes which I purchased, and these actually were really great. This is a 2.5x magnification, and if you're a new loupe wearer, you're going to find that wearing a pair of loupes is going to give you a little bit of a strain for the first couple of days, and then you're going to say, hey, how did I live without these loupes? So this was the second pair I bought. But then things got really interesting for me when I bought these, which are designed for vision. These are a 3.5x magnification. These are really nice. It's a plastic frame, it works well. But the main thing that differentiates this from my previous purchase was the fact that I purchased an LED light with this as well. So you would wear this and adjust it in such a way that you're focusing right where you need to on your patient. And there we go. So we get really nice illumination using this style of loupes. But these are the same, and Orascoptic will also sell you, of course, an LED light if needed. But I would say anything with an LED light is critical. Sometimes I even feel nowadays that probably the LED light is even more important than the loupes themselves, because illumination is always a struggle. And you know, people who don't use loupes try to use the surface of their mirror to reflect the overhead light, and that doesn't work so well. When you see stuff clearly, that really makes a difference. And a lot of young dentists ask me, should I invest in my office or should I invest in my dental chair? I stop them and I say, my biggest recommendation is invest in a good pair of loupes, because that's going to make all the difference to actually giving a very successful treatment for your patient and building your practice in that way. So in terms of a review, don't get these. Designs for Vision, Orascoptic, Surgitel, whatever other company you want to get is fine, but I recommend that you get your loupes with an LED light. And if you want to start off simple, start off with a 2.5x magnification and then move up to 3.5 or more magnification once you get more comfortable with it. Always buy customized loupes. Do not buy a ready-made pair of loupes which is not made for you. Your working distance, your interpupillary distance needs to be measured, and the loupes need to be made to fit you so that you can actually use it effectively. So until we meet the next time, this is the Dental Review Guy, Dr. Varun Acharya, signing off with a smile. Have a nice day.